There's another question about that actually regarding parents, especially new parents. Always the new parents always ask, because the minute they discover the diagnosis, right, first thing they do is go to the internet, right, and the first thing they find out is you should always stop with vaccines, not only for the child but also for the brothers and sisters and stuff like that. So again, I think we need to clarify on that, because on the internet everything is perceived to be the same level. Nobody actually checks the background of the person giving the advice. So as long as the internet is true, they always believe, So we need, if it's possible for you to clarify whether,
this vaccine thing has been around for a long time, and I understand parents getting worried. And the initial study is being disputed. The guy was struck off. I think it was in America somewhere, but it was disputed. From my own clinical practice, I can say to you, in my years of following up families with autism, there are siblings who have not been vaccinated who still develop autism. Okay, so there's definitely a genetic element in that. I understand parents' anxieties, why and why they think it's related. If we look at children with autism, and a lot of research is now coming out looking at infants' behavior. Okay, at 2 months old, babies with autism are the same as all other babies. They have good eye contact and things like that. But when they look at them, say at 9 months old, you can already see there's a drop in their eye contact and their interaction. It's not as sustained. But this is only in about half of children who later on go on to get diagnosed with autism. Another half continue to develop normally. And then round about 18 months or so, they seem to regress. Okay? Either they regress or they stagnate. Okay? Or they never pick up the communication and the interaction skills. So, and what they also have found is when they look back on home videos of children who were diagnosed at 3, half of them you can tell when they were babies that they had issues. And I see that a lot in my practice now. I say to parents that it is a bit of a, not to say coincidence, the timing of the MMR is that you give it around about 15 months to 18 months. But that's around the time where you start to notice that kids with autism also have these difficulties. Okay? So to blame it on the MMR, we don't have enough evidence for that. There are studies going on in the US looking at to see whether some children with autism react differently to immunizations. And maybe there's a small group, but it doesn't account for the bigger picture. Okay? So, I think increasingly we are seeing cases of measles, children dying. My neighbor's helper, was telling me she comes from Rawang, and she comes in every day, and she got worried because her kids had chickenpox, so she wanted advice from me. And then she said in the nearby nursery, 2 kids had measles and died. They were babies. We shouldn't have cases of measles dying. And when I worked in UKM, the orphanage next door to the hospital, back in 2007, 2008, there was a huge outbreak of measles in the orphanage. And in a space of 3 months, we lost 10 or 11 babies. These are orphans. Many of them are probably abandoned babies. But we lost 10, and it scarred a lot of my junior doctors and for myself. I used to see babies die. Never came out in the press. Why? Because these are all abandoned babies and people who don't matter to society. But we are seeing an upsurge of measles now in the UK. One thing we do know is, although the percentage is very low, something like 0.1% or 0.01% of children with measles, the virus lies dormant. And we suggest 8 or 9 years later to give you a degenerative disease, where it slowly eats away at your brain and you die in your teenage years. So we're going to see an upsurge of that.